Have you ever looked down at your feet and thought, that toenail didn't used to look like that? Maybe it has become thicker. Maybe it has turned yellow, white, brown, or darker than before. Maybe it is harder to trim, rough at the edges, or lifting slightly from the skin underneath. Or maybe just one nail has changed, while the others still look normal. After 60, it is tempting to brush this off and say, well, I'm just getting older, and sometimes age really does change the nails. But toenail changes are not always just about age. They can sometimes be a quiet signal from the body, a sign of pressure, fungus, blood sugar issues, circulation changes, skin problems, or, in rare cases, something that should be checked sooner rather than later. That does not mean you should panic. Most toenail changes are not emergencies, but they are worth paying attention to, especially when the change is new, persistent, painful, spreading, or unusual. Toenails are easy to ignore because they are not usually the first thing we think about when we think about health. But after 60, the feet matter more than many people realize. They affect walking, balance, independence, comfort, and safety. And sometimes the first clue that something has changed is not pain. It is a nail that slowly starts looking different. The confusing part is that many toenail problems can look similar from the outside. A thick yellow nail may look like fungus, but not every thick yellow nail is fungus. A dark toenail may come from pressure inside a shoe, but certain dark streaks should not be ignored. A nail that is brittle, hard, or slow-growing may be part of aging, but if it appears along with numbness, poor healing, redness, or changes in the foot, the meaning can change. So the goal is not to look at your toe and diagnose yourself. The goal is to understand the patterns. What is common? What may be linked to aging? What could be related to fungus, blood sugar, circulation, or pressure? And when is it worth asking a doctor, dermatologist, or podiatrist to take a closer look? Let's begin with aging itself. As we get older, nails often grow more slowly. They may become duller, more brittle, less smooth, or slightly yellowed. Toenails can become harder and thicker than fingernails because they grow slowly and spend years inside shoes, under pressure, friction, and small repeated injuries. This kind of change usually happens gradually. You may not notice it day to day. Then one morning, you try to trim your toenails and realize they are much harder to cut than they used to be. The nail may feel tougher, more ridged, or less clear. For many older adults, that is the first sign, not pain, not swelling, just a nail that no longer behaves the way it did years ago. But age is only one possible explanation. One of the most common reasons toenails become thick, yellow, brittle, crumbly, or distorted is a fungal infection. Toenail fungus can begin quietly, sometimes as a small white or yellow spot near the edge of the nail. Over time, the nail may thicken, become rough, break at the edges, lift from the nail bed, or collect material underneath. Toenails are more vulnerable than fingernails because they spend much of the day in a warm, dark, moist environment. Shoes and socks can trap moisture. Small injuries can weaken the nail. And because toenails grow slowly, a problem can linger for a long time before it becomes obvious. But this is where many people make a mistake. They see a thick yellow nail and immediately assume that must be fungus. It may be, but it may also be old trauma, pressure from shoes, psoriasis, another nail condition, or changes related to aging. Several nail problems can look alike, which is why guessing can lead people in the wrong direction. Some people ignore the nail for years because they think nothing can be done. Others try home remedies month after month without knowing what they are actually treating. A calmer, safer approach is to observe the pattern and ask for medical guidance if the nail keeps changing, becomes painful, spreads to other nails, or affects walking. Another reason toenail changes matter after 60 is blood sugar. For someone with diabetes, foot and nail changes deserve extra attention. Diabetes can affect nerves, circulation, skin health, and the body's ability to handle small cuts or infections. Thickened yellow toenails and fungal infections are among the foot problems people with diabetes are often advised to watch for. This does not mean a thick toenail means you have diabetes. It does not. But if you already have diabetes, prediabetes, numbness, tingling, burning, slow healing sores, or poor circulation, a toenail change becomes more important. A thick nail can press into the skin or rub inside a shoe. If your sensation is normal, you may notice discomfort early. But if nerve feeling is reduced, irritation can build before you feel much pain. That is why regular foot checks are so important for people with diabetes or nerve problems. Circulation is another part of the picture. Your feet depend on healthy blood flow. When circulation to the legs and feet is reduced, small problems can become harder to heal. Poor circulation may be connected with coldness in the feet, skin color changes, leg discomfort while walking, slow healing wounds, or a greater concern around cuts and infections. Toenail changes alone do not prove a circulation problem. But if nail changes appear along with cold feet, numbness, color changes, pain while walking, sores that do not heal well, or one foot looking or feeling different from the other, it is worth asking a healthcare professional about it. This is the bigger point. Do not look at the nail in isolation. Look at the whole foot. Is there pain? Is there redness or swelling? Is the skin cracked? Is there drainage? Is the toe warm or tender? Are your shoes suddenly uncomfortable? Is walking harder? Is there numbness, tingling, or burning? Did one nail change quickly while the others stayed the same? Those details matter. Now let's talk about color. Yellow or white discoloration is often associated with fungal nail changes, especially when the nail is also thick, brittle, crumbly, or lifting. But yellowing can also appear with aging nails, repeated pressure, old trauma, or other nail conditions. Brown or black discoloration can have several possible causes. Sometimes it happens after an injury, even one you barely remember. A toe repeatedly hitting the front of a shoe during walking, exercise, or daily activity can cause bleeding under the nail. That may look dark purple, brown, or black, and it may slowly move outward as the nail grows. But a new dark streak or band under one nail should be treated differently. A brown or black band that is new, widening, irregular, or not clearly linked to an injury should be checked. Dark pigment spreading onto the skin around the nail, nail splitting, nail lifting, bleeding, or a bump under the nail are also reasons to seek medical evaluation. This is not meant to frighten you. Most dark nail changes are not cancer, but melanoma can rarely appear under or around a nail, and many people do not know that. So the responsible message is simple. Do not panic, but do not dismiss a suspicious dark nail change as just fungus or just a bruise without having it looked at. Another common cause is pressure. Feet change with age. Arches may flatten, toes may shift, bunions or hammer toes may develop. Shoes that once fit well may begin pressing in new places. Over time, a toenail that repeatedly rubs against a shoe can become thicker, damaged, discolored, or misshapen. This does not require one dramatic injury. Years of small pressure can be enough. The big toe and little toe are often affected because they tend to take more contact inside shoes. If one nail is changing and that toe also rubs against a shoe, pressure may be part of the story. So what should you actually pay attention to? Pay attention to whether the change is in one nail or several. One nail changing suddenly may point to pressure, trauma, or something local to that toe. Several nails changing gradually may suggest fungus, aging changes, or a broader nail or skin issue. Pay attention to pain. Pain is not required for a nail problem to matter, but pain, tenderness, redness, warmth, swelling, drainage, or odor should not be ignored. Pay attention to lifting. When a nail begins to separate from the nail bed, it can happen for different reasons, including fungus, trauma, psoriasis, or irritation. Pay attention to thickness. A nail that becomes very thick can press inside the shoe, make walking uncomfortable, and become difficult to trim safely. And pay attention to what is happening around the nail. Numbness, tingling, burning, loss of sensation, wounds, color changes, or unusual coldness in the foot are especially important if you have diabetes or circulation concerns. Now, what can you do safely? Start by looking at your feet regularly. This sounds simple, but many people over 60 do not inspect their feet closely, especially if bending is difficult, eyesight has changed, or the feet do not hurt. A small mirror, Better lighting or help from a trusted person can make this easier. Keep your feet clean and dry, especially between the toes. Moisture can encourage fungal growth. Changing socks, letting shoes dry, and avoiding long periods in damp footwear can support healthier feet. Check your shoes. A shoe that presses on the toes can keep irritating the nail. If your toenails are changing, ask yourself whether the toe box feels tight, whether one toe hits the front of the shoe, or whether the nail feels pressure during walking. Trim nails carefully, but do not cut aggressively. Thick nails can be hard to manage, and cutting too short or digging into the corners can irritate the skin or contribute to ingrown nails. If you have diabetes, poor circulation, vision problems, numbness, or very thick nails, it is worth asking a healthcare professional about safe foot care. Be cautious with home remedies. Some people use strong chemicals, repeated soaking oils, or internet remedies because they hope the nail will clear quickly. But irritated skin, cracks, burns, or delayed diagnosis can create bigger problems, especially for older adults with diabetes or poor circulation. Also be careful with products or supplements that promise a quick cure. Toenail problems often need proper evaluation. Some treatments take time, and some may not be appropriate for every person. Oral antifungal medicines, for example, can have side effects or interactions and should be discussed with a healthcare provider. The safest mindset is this: do not panic, but do not keep guessing if the nail is getting worse. So when should you talk to a doctor, dermatologist, or podiatrist? If a nail change is new and persistent, get it checked. If the nail is painful, very thick, crumbly, spreading to other nails, or making it harder to walk or wear shoes, get it checked. If there is redness, swelling, warmth, drainage, bleeding, or signs of infection around the toe, do not ignore it. If you have diabetes, numbness, poor circulation, or a history of foot ulcers, ask for guidance sooner rather than later. Foot problems can become more serious when sensation or blood flow is reduced. And if you notice a new dark streak, a widening brown or black band, pigment spreading onto the skin around the nail, nail splitting, lifting, or a bump under the nail, it is important to have it evaluated. Even difficulty trimming your nails safely is a valid reason to ask for help. Foot care after 60 is not vanity. It is part of staying mobile, steady, and independent. The main lesson is this: toenails do change with age, but age is not the only explanation. A thick yellow nail may be related to fungus, pressure, trauma, aging, or another nail condition. A dark nail may be a bruise, but certain dark patterns need medical attention. And if you live with diabetes or circulation problems, nail and foot changes deserve extra care. Your toenails are not a diagnosis, but they can be a signal. A signal to check your shoes. A signal to look at your feet more often. A signal to think about blood sugar, circulation, skin health, and safe foot care. And sometimes a signal to let a professional take a closer look. So the next time you notice a toenail changing color or thickness, try not to ignore it and try not to assume the worst. Ask a more useful question: is this a slow aging change, or is my body giving me a clue that deserves attention? That one question can help you protect your feet, your comfort, and your ability to keep moving well after 60. This video is for education only and does not replace medical advice. If you have a nail change that is sudden, painful, persistent, spreading, dark, or connected with diabetes or circulation concerns, talk with a qualified healthcare professional. And if you want more calm, practical explanations about the body signals that become more important after 60, subscribe and keep learning how to listen to your body with confidence.